with that, I am going to actually hand this over to Dr. Friedman, who I will let you introduce yourself. But I just want to say this has been months and months in the making, this partnership. In fact, probably over a year ago. Wouldn't you say, Dr. Friedman? We got connected. He was in the process of becoming the president of his association and started working on this before it was even formally announced, his leadership. And we're so grateful for this opportunity to really make an impact across the country with this collaboration. So Dr. Friedman, I'm going to let you take it away. I'm getting off the camera. I'm going black.
Thanks, Melissa. And it's truly an honor to be speaking with you all today. As Melissa said, my name is Dr. Paul Friedman. I'm a board certified dermatologist. I practice in Houston, Texas. And I'm currently the president of the American Society for Laser Medicine and Surgery. And today it's my pleasure to speak with you on a philanthropic initiative and partnership that we are undertaking with the National Trafficking Sheltered Alliance. And the name of this program is going to be referred to as New Beginnings Branding Tattoo Removal. And we'll kind of just take you through our story and what we're doing here locally and our objectives in terms of what we're hoping to do for a nationwide campaign. And I just wanted to start off by saying that all images and stories that you're going to hear today and some of the branding tattoos that you're going to see today were consented to for release for the scope of this presentation. So I was first introduced to the world of sex trafficking in 2017 when Houston hosted the Super Bowl. And I was devastated to learn that Houston was one of the top cities for sex trafficking in the United States, given its proximity to the border. And after learning about branding tattoos over the last 5 years, I connected with several local organizations and have provided branding tattoo removal pro bono to many individuals. And at this year's American Society for Laser Medicine and Surgery annual 41st annual conference, we presented this abstract showing the results of a survey that we did and the needs and the impact aimed at assessing the role that a pro bono branding tattoo removal initiative could have on a nationwide effort. And this is what the 8-question online needs and impact survey looked like. And many of you were participants in this survey study. We sent it to 97 organizations that support sex trafficking survivors within the United States. And participating organizations were identified through collaboration with the National Trafficking Sheltered Alliance, as well as locally known programs. And we had 40 out of 97 organizations that responded. And you can see for about a 41% response rate, we had a 15% response rate from the Northeast, 20% from the Midwest, 45% from the South, and 20% from the West, going through all these different questions. And I'm going to go through the results of this survey. And basically the bottom line is we found that over 1,000 survivors per year could benefit from branding tattoo removal. And these were some of the responses that were recorded in the survey. Thank you for your being willing to remove tattoos, allowing survivors to feel as long as they are no longer owned by their trafficker. Right now, we usually have them covered up and it's very triggering. Erasing or reversing the mark of a trafficker is a critical part of every survivor's recovery journey. And another one that came in, our survivors would benefit greatly from the laser removal of branding as it would allow for another level of healing. And that's really what we've experienced here and through our local efforts in terms of the impacts. And that's what we were showing you in the video, is we actually interviewed survivors who had gone through this treatment process and just the impact that it had on their lives. And I would say what came through most during the documentary process was the word hope and how it had impacted them at so many different levels during their recovery process by having that mark removed, that constant reminder, and that how impactful it was in their recovery process. This is one of the patients that is currently undergoing treatment. And another potential benefit of doing this national registry is it will potentially allow us to establish a national database of sex trafficking tattoos that will help other healthcare providers with the identification process and serve as a way of educating healthcare providers who are coming into contact with these patients and not realizing that they're going through this, and to help with the identification and the reporting process. My patient, Kathy, who was shown briefly in the video, she underwent 5 treatment sessions, and here she is 7 months after her 5 treatment sessions with nearly complete removal of the branding tattoo. And you can see when done properly, these results are quite effective and safe. And that's something that we're going to reemphasize throughout this presentation is when you're going to the right provider who has the right expertise, as do the members of this prestigious society, you can achieve these kind of results. But this isn't something that someone with less experience can necessarily achieve, because somebody, especially with darker skin types, this is a more challenging condition to treat, because the laser can also be absorbed by the patient's own pigmentation, causing either lightening or darkening of the patient's own pigment. And so that's why I'll kind of go through best techniques and what we do for patient comfort and to achieve these types of outcomes in a video here shortly, so you can see how we're achieving these kinds of results. This is another patient who you may have briefly seen talking in the video. I'm sorry that the sound didn't play. Here she is before and 6 months after 6 treatment sessions, and she talks about the impact this made on her life during the recovery process. And both of these survivors were actually well along in their recovery process, but were still very bothered by these constant reminders of their past. And they talk about in the video how this removal process gave them that additional hope. In this case, this particular patient went on, was going through, got engaged and subsequently married. And this is the ring finger where her wedding ring currently sits. And so it's just really so inspiring to hear her story and how impactful this process has made for her. This is another patient with a tattoo, again, darker skin type, and you can see these dramatic results after 3 treatment sessions. And I think something I've realized through my work with these survivors is that oftentimes the tattoos are amateur in nature compared to a professional tattoo. And the advantages of that in terms of the removal process is the ink is usually less deep. And so it makes us helps us to achieve these types of results after so few treatment sessions. These are not typical types of results that I would typically tell patients. Achieving these kind of results after 3 treatments is pretty remarkable. The other thing I would mention is that there's advantages in terms of spacing the treatment intervals. And we'll go through that. But, you know, in my everyday practice for removing traditional tattoos, patients are often very motivated to try to come in as frequently as possible because they have the tattoo regret and they want the tattoo gone as quickly as possible. But it requires re-education to know that to educate the patient that it's your own immune system that is basically taking over after the laser tattoo removal process, after these ink particles are shattered into tiny little particles that then your body can gradually eliminate over time. And that's a gradual process. I mean, I've even seen patients come back 1 year later and they've told me that they've seen continued fading. So it's something where you can expect continued improvement for several months after each treatment session. So as I alluded to earlier, one of my main initiatives as president of the American Society for Laser Medicine and Surgery is to create a national database of board-certified physicians who will offer pro bono tattoo removal to survivors. My team has gotten to work right away, and over the past several months, we've even put out this new brand and this new name that we're calling it the New Beginnings Branding Tattoo Removal, because previously we've worked with survivors of cancer and the program was called Radiation Mark Removal. And this is an extension of the program for branding tattoo removal. And ASLMS is the ideal professional society to establish this type of directory because of our expertise in training with laser tattoo removal. So this isn't live yet, but I just wanted to, I'm kind of giving you a sneak preview of what this will look like, the ASLMS New Beginnings Branding Tattoo Removal Program. I'm excited to tell you all that we have to date, pre-launch, already 50 physicians around the nation who have already agreed to volunteer their services to this campaign. And once the website goes live and the directory goes live, this is what it's going to look like. It'll have some information in terms of how the program will work. And then the directory will help guide you based on the location of where you're located. So this is all happening behind the scenes. And then this is live as of today. This is our current ASLMS directory of providers, showing you where the various volunteers are around the country. We're already at, as I said, close to 50 providers. I hope to double this by the end of the year. And I'm somebody, as you can probably tell, is very passionate about this cause. And so I wouldn't be surprised if the number of volunteers goes significantly higher than that. So, and these are all providers that will have the necessary expertise, the trauma-informed training, who will know, who will be able to provide the best possible care to the survivors that you represent. And the reason why that's important is we've previously studied and have encountered patients who did not undergo treatment with board-certified physicians and had perhaps a non-physician operator in a non-medical setting and had some of the potential adverse events, including scarring or hypo or hyperpigmentation. There's no regulation in terms of the ink compositions that are performed by tattoo artists. And so there's certain types of inks that can actually paradoxically darken when treated with laser tattoo removal. And so another reason why you want to go to an expert. And with any medical procedure, there are potential risks and complications. And so it's important that you're seeking the care, that you're under the care of someone who has experience and can manage complications. And then, as I mentioned earlier, tattoo removal is more challenging in patients with darker skin types because of that potential risk and pigment interaction. And so, again, it's having somebody not only who has the expertise, but who also has the proper technology. And there's been a huge advancement in laser removal for tattoos with the advent of something called picosecond laser tattoos that deliver light much more quickly and that are much more efficient in shattering the tattoo ink particles, making the number of treatments required less. And it allows us to use lower energies, so it minimizes the chance of some of these adverse events. So there's a lot of expertise and technology that is very advanced that goes into this treatment process. You know, we mentioned earlier about the survey study that that we distributed to a lot of the organizations within NTSA, and we have witnessed firsthand the impact that this can have on survivors during their recovery process. And in the survey, we asked participants on a scale of 1 to 10, with 10 being the most need, pro bono services for laser removal received. For laser tattoo removal received an average need score of 9.1, with 10 being the most impactful on recovery. And the branding tattoo removal received an impact score of 9.2. So obviously the demand is there. And I just included this quote from one of the survivors that we've treated, and where they said, laser tattoo removal, this shameful reminder of being branded that I live with every day, and this is the words that were used, has been emancipating. I'm not sure people realize how imprisoning a brand can be. It chains you to a piece of the darkness forever. And so having the ability to remove those reminders has been truly inspirational. And As a member of the Shelter Alliance Network, you will have access to a database of board-certified physicians who are offering pro bono tattoo removal to survivors. And the database is being hosted, as I mentioned, by the American Society of Laser Medicine and Surgery. After locating a provider, you can then contact the office to set up an appointment. Patients will be required to provide a letter from the referring agency to the physician. And although the tattoo removal treatment will be pro bono, patients will still need to complete new patient paperwork and provide a copy of their ID. So who's a candidate for laser tattoo removal through the New Beginnings program? In my experience, working with survivors, it's best to treat survivors who are well along in their recovery process. Although interesting, I've had some patients say to me that they wish they had come in earlier because it would have helped them through the recovery process. I think what's most critical as you're speaking to survivors is that if they're going to move forward with this, this is a commitment in terms of both the number of treatments that are required, the compliance that's required with the recovery process, and the fact that you're going to have to complete a number of treatment series to achieve the optimum results. Ideally, in terms of who's ideal candidates, patients who are not allergic to lidocaine. Lidocaine is something that we inject. It's not a narcotic, but it is for patient comfort. And so when you hear some of these or read about some of these stories online regarding laser tattoo removal being painful, that's typically in a non-physician setting where injectable lidocaine is not administered. In fact, what's shown in the video is that with injectable lidocaine, it's a painless procedure. You feel a little bit of a pinch when the lidocaine is first going in, but then the whole area is numb, and it's actually quite a pleasant process. So the best candidates are going to be non-smokers, patients who haven't been recently on a course of Accutane, which is a medicine given by physicians for acne, patients who don't have a prior history of keloids, although we can still treat, just want to be a little bit more cautious. And then there's this rare interaction for patients who might have been on gold therapy, which is sometimes given for patients with arthritis, that can cause this rare reaction with laser tattoo removal. So we always ask patients about that. But most commonly, the thing that we educate patients on is that we cannot treat tan skin. And that's just something that cannot be emphasized enough, because it's frustrating if patients come to the office with tan skin and we have to reschedule their appointment. And then ultimately being able to commit to regular treatment intervals over the course of 1 to 2 years and having that commitment before moving forward with the treatment process. So a few key questions about tattoo are needed to estimate the number of treatment sessions that will be required during the process. And that's something that will be determined and talked about when the patient comes into the office and the tattoos are evaluated. But ultimately, as I mentioned earlier, it comes down to whether the tattoo is professional or amateur. The different inks are very important. So the black and dark blue inks clear very well, as you saw in some of those images. Green and light blue can be challenging with some of the more traditional nanosecond technology. So that would be something that survivors should be aware of. And then the red ink also clears a little bit more slowly with traditional technology, what we call nanosecond technology. But again, some of these issues are no longer relevant with more advanced picosecond laser technology. Other indications of poor response include multicolored tattoos, large tattoos greater than 30 centimeters, especially those located on the lower extremities. Newer tattoos typically respond slower. As I mentioned earlier, you want to space the treatment intervals to give the body the chance to clear the ink, and it will ultimately reduce the number of treatment sessions that are required. And as I mentioned earlier, cosmetics or flesh-colored tattoos can also pose challenges, as there's a risk for paradoxical darkening. And so if we have any questions regarding that, we'll often do a test spot just to make sure that there's not that risk of paradoxical darkening before moving forward with a complete treatment session. So what to expect pre-treatment? Again, as mentioned, you want to be careful with avoiding the sun. and then the importance of a broad spectrum sunscreen. And then patients should be prepared to spend about 1 to 2 hours in the physician's office for the numbing process, as we discussed, the actual treatment, and then the post-op care. And then there's the potential. A lot of our volunteers are either male or female, so survivors should be prepared to see either. And something that we've been working on closely with Alicia Merlo and NTSA is the importance of trauma-informed training. And this is something that we're going to have as a resource toolkit for our directory of providers, so that they provide the best possible interaction and treatment for the survivors, minimizing any chance of anything that might cause any type of triggering. So what do we mean by that? Well, certainly obtaining a good history, maintaining, leveling the relationship by maintaining a supportive, empathetic, and collaborative relationship, by encouraging ongoing dialogue, providing a clear message of availability and accessibility through the treatment, being very careful in terms of talking through the procedure to the patient before touching the patient's skin with the laser, making sure that the patient is comfortable with where the physician is being seated, in terms of making sure that there's no triggering by blocking the door, and ultimately, as mentioned earlier, by administering proper anesthesia so that it's a comfortable procedure. So let's get through, we're kind of wrapping up here, but let's talk a little bit about what to expect in terms of the treatment, and then I'll go through a video that will kind of take you through what this laser tattoo removal process looks like. So the skin is prepped with a topical antiseptic, then localized injectable numbing lidocaine is administered to the area to be treated to maximize patient comfort, and that typically will last 1 to 2 hours. And each pulse of the laser without the numbing feels like a tiny burst of heat, but typically with the numbing, it's very comfortable, and you can feel an audible snap with each laser pulse. And we protect the patient's eyes with either goggles or eye shields that will be worn depending on the location of the tattoo. And then, as you'll see in the video, immediately after the treatment, you'll see superficial crust of heated skin on the surface. And then patients will leave with a bandage on their tattoo, as well as a healing ointment that's applied prior to the bandage. And then treatment time may vary based on the areas treated. Let me take you through a video here. You can see here we're doing, in this case, picosecond laser. It's very fast, firing the pulses in picoseconds, which is 1/1,000,000th of a second, so quickly that when the laser energy hits the tattoo ink, it's shattered into very tiny particles that the body can gradually remove over time. And when the ink is absorbed, the laser energy is absorbed by the ink, you get these little gas bubbles that are forming. And that's what you're seeing here as the white crust. Now we're treating through this clear film. It's called a PFD patch. And that has several advantages. It actually serves as a heat sink. So it's absorbing any excess heat that might have traditionally been absorbed by the upper layer of skin, and instead it's going to the patch. And so it provides an extra level of protection to the top layer of the skin. And it's especially important for patients with darker skin types. It has other advantages in terms of allowing us to do multiple passes and serving as an optical clearing agent. But ultimately, it makes the procedure safer, especially in patients with darker skin. And then again, you'll see afterwards when we're done, some of the gas bubbles are starting to resolve, and those little crusts are starting to fade. And then you see the areas of some redness and what we call pinpoint bruising that will gradually resolve over the course of about a week to 10 days. And during that recovery process, it's going to be important that the area is kept clean, and that the patients follow the detailed post-treatment instructions that will be provided. And it'll basically help explain the whole process in terms of the post-operative care that's going to be required throughout the healing process. And that's going to look like this, where you're going to continue to avoid the sun. The bandage will be removed 24 hours following treatment and pat dry, and then gentle cleansing of the area will be performed twice daily with mild soap and water, followed by application of Aquaphor or Vaseline ointment. Patients are going to want to keep the site covered with the bandage after cleansing again, avoiding direct exposure to sunlight. It's going to be really important that there's no smoking during the recovery process. And then patients are going to want to avoid swimming pools, lakes, or other bodies of water during the healing process to prevent infection. And typically, the healing should occur within 1 to 2 weeks, depending on the area that's being treated. So I want to just take this opportunity now to acknowledge Melissa and of course, Rachel and Danielle for all their work and helping us with this partnership. As Melissa said, this has been actually several years in the making, and because we wanted to be at a point now, we're very early on in my presidency that we would be ready to move forward with launching this initiative. I want to thank Alicia Merlo for all of her help in terms of being a member of the ASLMS Philanthropy Task Force and providing her insight into the importance of trauma-informed care and making sure that we're and doing what we can in terms of reaching the survivors that can be most benefited from this program. And then, of course, I want to thank Michelle Morrison and Andrea Alstead with the American Society for Laser Medicine and Surgery for all of their help with this partnership. And on that note, if Michelle is here, we're going to actually have Michelle speak just briefly and talk a little bit about how the logistics of how this partnership will work. Thank you, everyone, for your attention.
Great. Thank you, Dr. Friedman. There was actually just one question that before we move away from your program, your part of the content, why is smoking and not smoking so important to the recovery process?
So in any type of post-operative recovery process, smoking can actually impact wound healing by the effects that it has on constricting blood vessels. And so as a general rule, especially for more advanced types of surgeries or procedures where there's a recovery process associated with it, ideally, minimizing smoking is imperative. If that's something that it's something that it could potentially be worked around, but this is what will provide the best outcome in terms of allowing your body to do the necessary recovery that it needs after a treatment such as this.
Great, thank you. Trisha, I hope that answers your question. So if not, just follow up, just let us know. So I wanted to take the opportunity actually to show you that website that Dr. Friedman was mentioning. We flipped the switch and it's live as of just about an hour or so ago. So we wanted to show you how you would navigate the website so you can get to where you want to go, because you're probably going to want to see where those providers are located on the website. And then we can walk through some of the steps and logistics and connecting with those providers. So I'm going to share my screen and see if we can make this work. So I am on my my webpage. Can you all see that?
I could see it.
Okay, great.
I can see it. Yeah,
Fabulous. I just needed one. That's all I needed. So when you're on ASLMS.org, there's a couple of ways that you can get there. I think the most straightforward way is going to be to click on this For the Public section, and you'll see this new beginnings menu item over here. And so when you click on this, it's going to give you the overview of our full New Beginnings program. And there are two aspects to the program. One is the radiation mark removal, and then the new one is the second one. And so you'll see the overview of the program, the radiation mark piece, and then of course the branding tattoo removal. And so it is most likely that patients and survivors are probably not going to find this website. This is probably here more for our physicians and members to find, and then of course for you all to find what you need. But it's certainly written with that in mind. And so when you get down here, we're just going to skip through because Dr. Friedman covered this part oh so well. So we're going to come down here to this Learn More button, and you'll click on that. And it's going to bring you to the specific page for the branding tattoo removal program. And so once you are in here, you can see on the right-hand side, there is this provider directory, and I think that's what you're going to want to click on. So when you do that, it will bring up the list, the directory list. As he mentioned, there are 49 people on this list right now, or at least there were as of about 45 minutes ago. And so when you're in here, when they notify us, then we go into their member record on our end and we just check a box, and this is actually talking to our member database. So it's accurate as of the moment when you load the page. And so when you come in here, if you wanted to type in, I mean, you can sort a couple of different ways. You can sort by zip code, but it's probably easiest to sort by either last name or by state to find what you're looking for. You can also come up here and you can type in a city. It's going to be very city specific though. It's not going to be the greater metropolitan area of if you live in a larger area. But if we type in Houston, you'll see that we do get a couple of results here. And so you can look through, look by going to Houston, you can come back into here and you can go into, and sort by Texas and narrow it down just from Texas. And so there's a couple of different ways that you can sort and configure within this list to make sure that you can find providers in your area. So what we're going to be sharing with our physicians is how to, or what to expect when they're contacted to provide care. And so what the arrangements that we've worked out in coordination with NTSA is that we're going to share with them that they can expect for NTSA members to reach out to them probably directly. I don't think we're expecting the survivors to reach out to them unless if there's some unique situation. We're expecting them to receive that call from the NTSA member. And so with that, they would be asking for a formal letter. I wrote it down, a formal letter of, where's my word? Of support. Thank you. A formal letter of support from NTSA, just to indicate that you are a member in good standing with NTSA, so that they know that your word is going to be trusted, if you will, so that to know that survivor is ready on their journey to have this type of treatment done. So with the radiation mark tattoo removal, we have an oncologist letter that we require. With this particular program, we just needed to figure out the best way to make sure that our physicians know that they're reaching the population that they're intending to serve. And so the best way to do that is to ensure that they have some type of validation in place. And so they will ask you for that letter. We'll provide them with a sample of that letter so they know what to expect. And then you can connect with the physician and be involved in the process as much as appropriate given your situation. So we'll be sharing some information and resources with those physicians, whether it's the trauma-informed training, like Dr. Friedman mentioned, whether it's other things that they can read and take note of as they're working with the patients, and we'll continue to follow up with them as well. So, but as far as connecting to physicians in the area, it's probably through this website. And then, of course, as I mentioned in one of the questions that came through, if you don't have a provider in your area, you can reach out to NTSA, and then they will reach out to us to say, hey, we have a need in this particular community. Any chance you have someone that you might be able to recommend? And so we can reach out to members in that area to try to find a provider who's willing to be a part of the New Beginnings program. And then we can follow up when we get that confirmed. So there's just a couple of ways to try to go about it in the event that you don't have a provider in your area when you look.
Thank you, Michelle. Will you scroll down just to show the
Yes.
Of the different
This is alphabetical by last name. And there's a couple of pages worth. But you'll see, you know, at least in the world of dermatology and ASLMS leaders, there are some very well-known leaders in the industry that have agreed to be a part of this program. So it's very exciting.
Yeah, and get to your point earlier, I had a conversation with Melissa last night that Washington, we needed a representative in Washington, and I actually reached out to some colleagues this morning. So this is pre-launch, you know, this is a work in progress. So, you know, just please let us know your needs and continue to check this directory for new volunteers.
Awesome. I am so excited about this collaboration. I can just speak on behalf of all NTSA members. This saves us months and months and months of relationship cultivation with local dermatologists who might not even understand what trafficking is, let alone branding, let alone the trauma process or the process of caring for them with that trauma-informed lens. So grateful for this collaboration. Thank you, Michelle and Dr. Freeman, for your initiative in this. Not just initiative, but like follow through and follow up. It's just been absolutely refreshing working with you guys and your entire team. And everyone, thank you for being here. And maybe see you in November, maybe see you at Sheltered Conference in person in March. Either way, so grateful for the work you guys are doing. Thank you for being a part of NTSA, and we'll see you all soon, hopefully.